As we talk about the considerations, is there an age gap? Is there an age gap?
Yeah,
Yeah.
there's an age cap
Yeah.
and there's an age bottom, I would say, as well.
Okay.
So although there are exceptions, generally we should wait until we're 18
Okay.
before we have any surgeries done like that. There are exceptions, and those exceptions include breast reduction.
Mm-hmm.
So I've had patients who are 18 and 17 who are who have a history of years of suffering from excessive breast tissue, macromastia, gigantomastia, and you can't imagine, but these kind of patients, I removed 1.2, 1.3 kilos on each breast.
Is it hereditary?
It can be hereditary, totally, yes. And often they come with their mothers,
Okay.
and their mothers know the history. They know from themselves having big breasts and not having had the option of having something done. So they often bring the daughters and say, look, we know what I went through. I don't want you to suffer the same. So breast reduction is a very good example of a procedure that can be done at a lower age.
Yeah.
Most of the patients that I see are between 30 and 40, maybe even older, even 50, I would say.
Mm-hmm.
The top of the age range, I think it's pretty much up to your medical status. Like if you're healthy, if you can withstand 2 hours of anesthetic, and you really want to have it done, then you can even have a tummy tuck at 70. But I have to stress, there needs to be a good reason for this, you know, why you would want to risk it at that age. But, you know, sometimes I get clients who've had breast implants, for instance, in their 30s, and now 20 years down the line, they want to have them removed. So I can't really tell them, no, you're too old for this.
Yes.
And in those cases, it's also, again, life-changing to get the implants out,
Yeah.
do maybe a breast lift, add some fat, so just to
It's a personal-
reconstruct what they had. Yeah.
It's a personal choice at the end of the day.
It's a personal choice, and it's a choice that you have to make with your and also your surgeon has to be happy.
We're talking to Dr. Tillman Stasch, a plastic surgeon. And today's conversation is why do many of us are now leaning towards cosmetic surgery. And also when you talk about cosmetic surgery, it also includes constructive surgery. When you've had an accident, when you want certain changes, when you've been unwell, and it also includes part of healing. So let's not be very judgmental when it comes to that particular issue. Before we went on the break, you were talking about what we need to do or what needs to be considered before you actually go under, or what you don't need to do. You were talking about people need not take garlic or capsule tablets that are related to garlic.
Yeah, that's one of the supplements, I
Yes,
think, that,
yeah.
that can thin your blood.
Yes, or blood thinners. If you're in blood thinners, you have to
of course.
declare it.
Yes, yes.
Okay.
Yes. Mm.
What else?
Okay, so just generally, as I mentioned, your medical condition, your heart, so the medication you take, to make sure that we don't have any allergies that you could be reacting to, the special investigations that I mentioned, just to make sure that everything during the surgery is safe and that we don't have any surprises.
Now, you talked about there are people who could go under local anesthesia, and after they've finished, if it's Botox, if they come back looking and glowing like nothing happened, they slept over it and wake up. How about other procedures? Is it instant that, for example, I was doing a mommy makeover, or a gentleman was doing one of those chest things to remove the breasts? Is it that when they wake up, it will be all gone, or it's a gradual process when it comes to healing and the transformation?
I think the answer to that is you see the instant change.
Instant. So
Once
I went in,
yeah.
this, I'll come out that.
It's
That picture that we had.
Pretty much, yeah. Not an Instagram picture,
Oh, yeah.
maybe to add to that. So, but after the first dressing change, which
Yes.
usually happens after 2 or 3 days after the surgery, we kind of unwrap. I'm sure you've
Yeah.
seen the TV series Botched, where they then
Yes.
celebrate taking off the tapes and the gums. Now, it's not as glamorous as that, because normally it's blood stained.
Or dramatic.
Patients are in pain and it's
Yeah.
uncomfortable. But yes, you see what has happened and what your new body will probably look like.
Okay.
So somebody who's had 5 liters of liposuction and the tummy tuck done, of course, they can see the difference immediately. I always warn them,
You know, when
don't.
you're saying 5 liters, I'm trying to figure, that's quite a lot.
That's 5 kilos. Yeah,
That's
so
a
that's
lot.
I would say that's the upper limit of what I'm comfortable with taking.
Out.
Because it certainly affects your body. Imagine
Yeah.
you lose 5 kilos of your
Like
your,
on
of
a
your fat.
particular place.
Exactly.
Yeah.
So I always tell my patients beforehand, okay, don't look into the mirror because you'll have bumpy skin, you'll have kind of irregularities, you'll have swelling. So the first time you should really start looking is after 6 weeks.
So after I've done maybe a mummy makeover surgery and I am wrapped and I go home, I should take at least 6 weeks before I look at the mirror or expect changes.
No,
Unless it's the 5
no,
liter thing.
No, you see it immediately. I think that's what I'm talking about. But the bikinis and the new clothes you don't want to buy before 6 weeks are over, when probably 80% of the healing is completed. So as anything in the body, everything takes about 6 weeks to 3 months to heal. So the final results when we take the before and after pictures is about 3 months. But just to answer your question, yes, you can see the difference immediately, especially if you've had a breast reduction. You can actually now sit upright. You've had a tummy tuck. You can now see your legs for the first time. However, there is a healing process involved. And that is very important that patients understand that it's not the kind of, okay, you wake up and you can have an Instagram picture and you look amazing. It is your body has to heal and it needs time to do that.
Yeah.
If we're honest with yourself, for example, maybe a Barbara out there would like to do cosmetic surgery and they're looking for a mummy makeover, and you're telling me after 6 weeks, within those 6 weeks, am I going to be able to go to work, or is it the 6 weeks that I'm going to be on bed rest?
No. So bed rest, not at all. So
Yes.
I don't even know one patient that I want to on bed rest because we want to prevent any complications like blood clots in the legs.
Okay.
You're wearing the stockings. I chase you out of bed immediately.
Yes.
The next morning, because we want you to be active. As you know, maybe 50 years ago, the doctor ordered bed rest.
Yes.
And yes, if you're sick
After,
with a flu, then you should stay in bed. But after surgery, we now know that the heart rate is normalized, the breathing is normalized once you get out of bed and once you start doing stuff that are normal for you. Of course, you can't go back to work immediately.
Okay.
There are some procedures where you take off 1 week, and there are other procedures where I would say you take 2 weeks. During that time when you're off, you just concentrate on the healing, eat the right things, have the dressing changes at the clinic.
So you have to come to the clinic,
have to come to the clinic.
Do you make it like a ward place?
Not at all. No, you have to come back. So you go home the next day after the surgery, but you come back to the clinic with a nurse or myself doing the dressing changes just to make sure everything's healing well.
Yeah.
And then after that, once most patients feel it, okay, now after the week, I can actually go back to work, or after the 2 weeks, I'm now ready to go back to work. Of course, they can't jump around and do everything again, like go jogging. So that usually takes a few more weeks. But some of my patients come in after 2 weeks and they're like, hey, I can't believe you've had major surgery 2 weeks ago. And others still suffer a little bit. So they're still in pain, they're still uncomfortable, and for them it takes just that much longer.
Yeah.
Does someone's life go back to normal? Like, for example, you did whatever procedure, and because you said you can't jump, so fine, I understand I can't jump for the next 2 weeks or 6 months, but going forward after I heal, can I go back to the activities that I used to do or wanted to do?
And more, I think.
Okay, nothing will tear. Out of just curiosity.
But that's why we kind of use the 6 weeks where we know that most tissues in the body are super strong again after healing. Majority of patients start after 3 weeks, 4 weeks of doing exercise again and other things. So the first 2 weeks are the most important to kind of keep it easy, and after that, it's good to go.